please stand for a moment of silent prayer. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I will call the February 16th regular meeting of the Doddridge County Commission to order. I don't think we have any minutes to review, so we'll go right into the public comments. I don't see anybody that wants to comment publicly. How about the commissioners? I remember.
No,
Yeah.
I'm good.
Let's welcome everybody to our meeting, and I think that what makes me feel good to see public input come to our meeting, see how we conduct our business and what the county's doing. Thank you for coming out on a day like today.
Yes, as you can see, we just got this room painted, and then this morning I guess you could say the ceiling opened up, but and it doesn't look any better upstairs. We got to get that fixed. But anyway, we'll get through. Things are a little different than normal, but hopefully we'll get through without any further problems. First on the agenda, mapping and addressing, road naming.
This is the second reading for, excuse me, for Davis Farm Lane. It's off Lick Run.
Okay.
Yes, the private road off Lick Run Road is the first drive on the right, containing 3 addressable structures.
Okay. This is the second reading, so do we have a motion to accept?
So moved.
All in favor, signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries. Thank you.
Thank you.
You need to bring 2 of those. I forgot to call you, Kay. So I need another one from the last one because we put the tape to keep an original too.
Okay.
And I didn't get your call to tell you. So
There was, I can't remember who it was, there was a lady that called me and I faxed, actually. I have it in the folder. It's a copy of the news release. I faxed
which
it.
I have that. I need this. to go
Copy of that?
around. Yeah.
Okay.
Do you have our address, mailing address? It's, Sweet one.
Thank you.
Thank you.
See you guys later. Watch for high water.
Next on the agenda is Sandy White, Ritchie Regional Health Center.
Hello, how are you all?
Hi.
Good, and you?
I'm doing well today, thank you.
I have some information to share with you. There's just one pamphlet about Ritchie Regional Health Center as a whole to look to pass amongst yourselves. And then I have 3 individual talks about the school-based health center and what I'm going to go over today. And this is our financials, audited financials for last year. Please forgive me, my medication makes me have a dry mouth, and nervousness doesn't help any of that either.
Well, you don't have to be nervous for us.
Been a while since I come and talk to you, so
If you would.
Come further?
Yeah, a little closer to the,
is that
because
better?
I think it probably.
Ritchie Regional Health Center is a family doctor and dentist office on Main Street. Just to give you a brief history, we are a federally qualified health center. And because of that status, we can take patients with insurance. If they're underinsured, they don't have any insurance at all. We have a sliding fee program for those without insurance, so we can offer reduced rates based on the number of household members and the total household income. And we've been in West Union since 2008, and we have outgrown the facility, and there's some limitations with that facility, parking being a big issue in Main Street to have our patients take up a lot of parking spaces, and the confined quarters, and it's just a small space, and we need to be able to get some elbow room and offer some parking for our patients and have a center that flows better, that everybody can be proud of in Doddridge County. So I am coming today because we have we've been looking since we came here to find a new place for a new facility, just because it is quite small. We only have 2,000 square feet where we currently are housed. And we only have 2 dental exam rooms and 2 medical exam rooms. So things are quite tight for us, and there's 8 to 9 people working there a day. So we step on each other's toes, and so we'd like to spread out a little bit. And an opportunity has presented itself that a new facility could be built, and we were looking to lease. We would have to move our current location to another location in West Union if we definitely go through with this. We're in the negotiation stages. The only problem with us being a nonprofit, we don't have the resources to be able to purchase outright additional equipment for the new place, or the relocation costs are both expensive. And I've priced those out, so I kind of know what that's going to cost us. And I'm here to let you know that we really want to grow to a bigger facility, to have more advantages for patients in our center, that we can better serve the public. And we're going to need some assistance to get that done, and that's what I have presented to you today. We're excited about the possibility of moving, but we know we need help to do it. So my request is in front of you. I understand that at times you tell people to submit applications in a certain time of the year, and I just wanted to let you know what we're looking at and see if you can help us in any way. And if you have questions, I'd be more happy to take any questions.
When is this going to try to happen, Sandy?
We would like to get forward and started with this as soon as possible. If we could start when the weather breaks to start moving ground, it would take about 6 to 9 months to have it completed. So we would be, the quickest we could move in would probably be the end of 2016.
I see here that the new facility will have 2 additional medical exam rooms and 1 additional dental operatory.
Right now we have 2 dental operatories and 2 medical exam rooms. If we can expand to have 4 medical exam rooms, we can house 2 medical providers at the same day time, so we can have a doctor and a nurse practitioner. And if we have the 3 operatories, our dentists could flow better and see more patients per day. Right now, Dr. Gaynor is booking 6 weeks out, so there's high demand for his services. And And we would like to be able to get that reduced, that people don't have to wait that long.
Right.
You can come in sooner for an exam, but the actual procedure takes 4 to 6 weeks to get scheduled.
Would you hire more people?
We would be looking for the dentist. That's up in the air. It would depend on if it's hard to recruit a dentist in Doddridge County. That's one of our hardest critical things for us is to try to recruit medical doctors and dentists to this area. It's tough to do. We are thinking to speak with WVU and maybe offer some internships with the students. Might be a possibility better for our situation to expand the providers.
Good. So would you be able to, will you be offering any additional dental services than what you offer now?
It won't be additional, it possibly be more, we might have extended hours on a Saturday perhaps, and most likely for medical for sure. The dentist, with having one dental provider, I don't know that he would be every Saturday, but we're definitely talking about expanding to Saturdays.
Right. Good. Well, you know, we're always looking to help people improve, and this seems to be a move in the right direction to me. But do you have any?
I think that, like you said, it's improvement for Doddridge County if we can bring more people in on the weekends, you know, maybe to the doctor's office and dentist. Because a lot of times people don't want to drive all the way to Clarksburg sometimes, you know, and that's where Parkersburg.
We do patient surveys, and our biggest patient complaint is that our waiting room's too small,
Yeah.
that they don't like to mix medical sick people with dental sick people, and we have no parking.
Right.
So, and that's truly what our complaints are. This facility addresses those needs. We would have our own parking. We wouldn't be competing with Main Street parking. We would have actually 2 waiting rooms is what we're planning, to have one side medical and one side dental to separate the sick from the well. And if we are a new modern facility, more people and have greater access. We have some difficulty with older patients and not wanting to park at the other end of town to walk to our facility. So we truly believe that our patients will increase just because of access, and if it would be much easier to recruit a doctor if we had a nice facility that looked like a medical facility.
Right.
So that's the reason we're driven from what our patients want, and it's needed.
Did I hear you say where this building is going to be?
In West Union.
Where?
We are looking in the area close to the library.
Okay. And what's the move date? You have a date?
The lease has to be signed before I can get a move date. But they told us when the weather broke, they could start right away with working on construction. They estimated for us to be in there before the end of the year.
Okay.
And you got her hand up.
How much is she requesting?
Requesting for the Doddridge County Commission $50,000. This is just a one-time then? Okay. And the move and the purchase of the new equipment is going to total $70,000, so I assume you're assuming that $20,000.
Right.
Any other questions?
No, thank you.
No, I'm good.
Okay, you've heard the presentation. Do we have any comments or motions? I will make a motion that we grant the $50,000 request to provide for the move to new facilities in West Union. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you. Appreciate it very much.
You're
You're welcome to keep that information.
Okay.
It's up
We
to
can
you.
keep this?
You can keep that.
Okay, thank you.
Thank you.
Next on the agenda, VFW and American Legion, Honor Roll and Pavilion at Park.
I think Mr. Cocker gave you guys a copy.
Yes.
The document. This is on the pavilion at the park, it's a breakdown of the cost. We have submitted a grant. I don't know how long it's gonna take to get an answer on that grant. We submitted a grant for $10,000. What else we have on that area is up to you all, basically, what all you want to decide on that. My only other comment is, we have some people who have considered giving us some money in relationship to the honor roll, but we need to get an idea, if you can tell us how long we're gonna have to wait to find out something.
You mean now is this just for the
That's just for the pavilion at the park.
pavilion? Okay.
And we have the one grant that is for that,
Right.
okay?
Okay, so you're looking at,
About $50,000.
I say we're.
58.
Yeah, we submitted a grant.
58,
Yeah.
735, 58, 735.
Mhm, yes, sir,
That's just for the park?
yes.
Okay. I have a question. Well, whenever you're done, Rick.
No, that's fine, go ahead.
I have a question. It says, will for relocation of existing flagpoles along the park road entrance. Can you tell me what you got planned there?
Well, and that's still a possibility. What, you're familiar with the park, and there's, I think, 6 flagpoles up and down that driveway.
Right.
Which are actually up against trees and are basically not usable where they are.
Okay.
We will possibly try to relocate those if it's not too much of a problem.
Okay.
Along with some new existing flags, to have a flag for each branch of the military,
Okay.
an American flag, a West Virginia flag, and a POW flag.
Okay. Thank you.
Where is this going to be
The
located?
pavilion
Yeah,
will be on the left as you go in, on the left of the main building. There's a area down through there to the left by the old school.
oh, okay,
Down in that
down below
area.
the, down below the parking lot down there?
Right, down in that area.
Okay.
Okay,
So.
okay,
And like I said, on the other part, which we discussed the other day, and you all have some evaluations going on, we have some people that are interested in helping us with that part, but we need to get some idea of how long we need to wait before we can get an answer.
well, I can sort of give you an answer to that. You know, as indicated at the last meeting, you know, we've got to do a needs study, and I think we're advertising for that right now or
It
not?
didn't get on the agenda for today.
Okay,
We're gonna put it on for March 1st, it has to be approved. Now it's class 2 legal, so that'd be 2
Okay.
weeks and a week submit, so at least a month.
okay. So it's going to be at least a month before we can advertise?
No,
for-
it'd be a month, as from March 1st,
Okay,
it'd be 3 weeks till we get the bids, and then possibly another 2 weeks before they can actually, they start on the needs study. So I'd say a month and a half before it's
Okay.
done.
okay. So it's going to be a month and a half before we can even start on the needs study. And as I explained at the last meeting, you know, we don't want to build anything bigger than necessary, but we want to have enough room for our employees and the various, and you know, we probably are going to end up growing here in these offices. I know of one elected official is going to request an additional employee because of their workload. So anyway, we won't know until that needs study is done, and I don't know, has anybody up here ever been involved with anything like that? It might take 3 months.
She didn't give me a definite idea because they're not sure what they're gonna run into when they look at the electrical and they look at the roof. Then they're gonna conduct individual, I guess, interviews with each elected official to see what kind of work the department does, how many individuals they currently have working, what their thought of need is gonna be in the future and possibility of expanding, that kind of thing. So I would say that it's not just gonna be done within a few days.
Yeah.
'Cause it's one of those things that we're gonna have it done, we're gonna make sure that we get it done the first time and get it done right, and we address everything, critical, moderate, low.
Well, like I was saying, the park part, the pavilion part, you have everything on it, so you all can decide what you want to do on it. The one here, like I said, we have I know at least 3 organizations that's willing to help us, but we don't want to do something
Right.
if it's going to be destroyed, so.
Well, I think there might have been just a little bit of either misinformation or misunderstanding because I don't think we indicated that there was going to be any destruction. What we indicated was that there will be potential renovations. And I don't want anybody to think that we're going to destroy anything because, that's important. That honor roll is very important to the county and all the veterans. But, we have some plans that were presented to us that included that area. And we don't want you to spend a whole bunch of money, whether it's donated or whatever, and then have to you come back in and spend a whole bunch again. That was my only concern. Once we get the needs study, then we have to advertise for, I think we have to advertise for an architect. And then we have to select, it's going to be a considerable length of time before we would know, number one, whether that's going to be part of. There's always a possibility that we would go with a building back here somewhere, back behind the sheriff's office or where the sheriff's office is or something along that line. But we're not at the point yet where we can even make any kind of a determination because we don't have any.
Well, that's why I was asking.
Yeah, and it's
if
good.
you've got something, if you have any time that you can tell us what's going to affect out here,
yeah,
then we can go to some people, and I'm pretty sure that some of them is going to give us some donations to help us do the things that we're asking to do.
right. And
which would make it easier for
yeah,
you.
and that is as soon as we can determine, we'll be more than happy to let you know.
Okay. And that's all we're asking is
Yeah.
just to let us know before, because like I said, we have, I know at least 2 or 3 organizations that's willing to give us some help
Yeah,
and redoing the honor roll.
yeah. Well, and that's admirable that organizations want to do that. But that's sort of, and that's why I said I could give you an answer, sort of.
Well, yeah, and that's why I was asking.
Yeah, that's sort of
so we'll know.
the answer to your question. I'm sorry it can't be any more.
Okay. Well, you have the information on the pavilion, and that's the one thing.
Well, we can.
That's
We have it.
Yeah, we've got that.
And like I said,
and you say you have you have a
We-
potential for
We have
10,000?
submitted, yeah, a $10,000 grant, so.
Well, do we have anybody else have any questions?
And the total prices are $58,000, right?
Pardon me?
The total price is $58,000 for pavilion, right?
Yeah.
Okay. Do you want 48,000, what you're asking for, Donnie, or you're asking for the whole 58,000 today and then we get the $10,000 back? See what I'm saying? I'm not sure how the grant would work, you know?
I'm not either, because, you know, I'm not familiar with putting in grants, I don't know how long you wait, I don't know anything about them, basically. I would tell you that Donna Hudson's the one that helped us work on the grant, so.
Oh, okay, Mark?
What we're putting in for is a $10,000 grant, which would pay for the concrete pad. That's a specific grant that we have to put in for,
Okay.
okay? And we just won't know anything for anywhere from maybe 2 to 4 weeks or maybe longer, depending on the grant process goes.
Are there any restrictions on grants normally? Do they, you know, if the county commission funded the whole thing, and could the grant be given back to the county commission, or?
Depends on the grant, and usually it's specific to the grant.
I think the way it would work, once we would find out, since we're not gonna start building tomorrow anyway, we can put the specific grant in just to pay the concrete guy for the pad.
Okay.
And that would, and me and Rex will, and we're working on that grant, and we can specifically say, okay, we want to pay, if we get the grant approved, we'll pay the concrete guy. That'll take care of the concrete pad. If we get the grant. The worst case scenario is what you got in front of you.
So I guess the question then is, when do you anticipate starting?
We would start sometime in the spring, April-ish.
So I guess to extend that question out, it would be, would there be enough time before any funds are needed to know whether you would get the grant or not?
Yes.
Okay.
I think the timeline's good, that we would know whether the grant is accepted or declined before construction would begin.
Okay.
Yes.
Because I know the grant has to be in, I think,
Yeah, it was submitted
next week
already.
or something.
It was submitted yesterday, actually.
Okay.
So, I think the jux of it is if the county commission, if you want to delay until we're ready to work, that would be fine too, but any monies raised for the pavilion by the VFW or the park could lessen the burden on the commission's contribution, basically, I think is what you're looking
Yeah,
at.
that's why I'm looking at, yes.
Well then, how do we go about, without knowing what that is, how do we go about deciding on the amount?
Could we just put, that we agree to pay up to $58,000 if they need it, and then if they don't need it, give it back to, you know what, they don't use, give it back to us?
Or not draw it or not
Yeah,
use it?
not draw and use it, yeah,
I think that would be fine.
yeah.
Okay. All right.
So I'll make a motion that we approve the total of $58,000, whatever it was,
$735.
for the building. If you don't need, back to the county.
Have you made a motion?
Yeah, I made a motion.
Okay. I don't know if I asked you if you had any questions or not, but or did you already?
I asked one question, that's all I needed.
Okay, that's
But
fine.
let me understand the motion. We're going to grant them $58,735, and if they don't need all the money, the commission gets refund, correct?
We will only draw down what we need to spend, sir.
Okay.
Yep.
Okay, thank you.
Okay. All right. Everybody understand the motion?
I do.
Okay. We have a motion to fund $58,735 for the Veterans Memorial Pavilion at the Doddridge County Park. All in favor, signify by saying aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
Thank you.
Thank you. Okay. Next item on the agenda, Debbie Davis, Doddridge County Health Department. I'm real good. How about yourself?
I'm fine.
Good.
I'm on your agenda today to talk to you a little bit about some of the things that are happening with the health department. And we've invited Ms. Mace to talk to you too. But the way this all came about is the health department's being cut in funding, 25%. I'm sure you read about that this year. We're looking at additional cuts probably each year. Grant funds are decreasing, while at the same time the Bureau of Public Health is imposing new standards upon us, things in addition to what we do now that we will be expected to do in the future. And even given the full amount of money that we have now, it would be impossible for us to accomplish those tasks on our own. It will be mandated that we do these things once the performance-based standards come out. They're still working on those right now. There are 10 essential services and accreditation standards that are already out that they would like for us to meet. That is hard to meet for us. It's hard for us to meet on our own. So our board began exploring different avenues of how we could accomplish all this, yet continue to have a health department here in Doddridge County. The board feels very strongly that we want a local presence here. We don't want anything to happen to that. And the different avenues we're exploring are possible regionalization, and that entails a lot of things. We've talked to Ms. Mace. She's come and presented to our board, and a lot of things she said we liked. A lot of the things we've heard from other people that we possibly could look at arrangements with. We might not keep a health department in our county, and that's one of the main things. We had a lot of questions for her, different avenues, different questions, and she'll go over some of that with you, what her proposals are. But I can tell you, over the past few years, we've worked with Minnehaha Valley Health Department. Anytime we had a need, they offered to help us. No strings attached. We didn't have to pay them. We didn't anything. Come on down. We'll help you. We'll come up to your place. We'll help you. We haven't had that relationship with all areas of the state. And we do appreciate everything they've done for us. And like I said, the board is exploring their options. And Minnehaha Valley was the first person we had come to speak to us. Chad Bundy from the Harrison County Health Department will be coming to our board meeting next week to speak to us about what his views are. And with that being said, any more questions for me before I present Dreama Mace? Or, well, maybe once she speaks, then you'll have more questions for both of us. Okay. Dreama?
Thank you all for allowing me to come and talk with you.
Well,
Give you
coming out.
talking to. And so I'm with no, that's me. Looked there for a minute like I had somebody else. And sorry I came into your meeting late. I was up at the legislature working on the bill that Deb was just talking about. It looks like it's going to move through the legislature. It will require counties to work together on some type of consolidation if it passes. It's an if. So the first thing I want to say is I am not about coming to take over anybody's health department or anything. This is things that Deb and I have been talking about how we could preserve that local presence. All the county health departments that are under the Minnehaha Valley, and it's the Ritchie County Health Department, it's the Calhoun County Health Department. It's not the building's taken over and it becomes the Minnehaha Valley Health Department. What it is a way to build inefficiencies into the system so that you have it allows you to enhance your programming, actually bring more, we'd be bringing more programs to the county. I like the county health department. I grew up in Boone County, and our local health department was very important to me and my family as we grew up, and that local health nurse was the key person. So that's how I differ with the state folks on this bill, is that I really think the local flavor needs to remain. And I think that the county commissions and the local boards of health need to deal with the health issues in their counties as long as they can. So what we've been talking about is looking at ways that we could, and it's just a possibility, what I've offered is that we would develop a plan. And that plan would only be put into place if the bill passes and you're forced to regionalization. So I don't mind taking the time, nor does Deb, to work on putting a plan together. So what I'm coming here for today is just to ask your all's permission to go ahead and move forward with the plan. Because it would have to come back to you as the county commission before anything ever happened or the plan was agreed upon. But Deb and I want to work on ways that we can see how that could happen. And some things that would, like group purchasing and consolidated payroll and, for example, my environmental health director is, she's not mine, she's Nita High Valley's, but sorry, Liz Green. And then our clinical director, Tanya Lane, came over with me to, so that if you had any questions that were specific to those programs, an example would be that you have a contracted sanitarian in this county, but we have 9 sanitarians and probably will be adding another. And not that the person you have would be out of work at all, but that we could increase those services, within the county because we're building in, efficiencies. In our environmental health, Liz is working on meeting national standards for environmental health. So she's taken us through the process, she's written some grants. So there aren't any other health departments in the state right now who are meeting the national standards for environmental health. The state is working on trying to do it. So Liz is trying to get ahead of the game by doing that. We have a division of health and wellness, and those kinds of things are education in the community. We have 19 AmeriCorps workers now who work out in the counties as community health workers. They'll go into if you have patients, especially the elderly, who have a hard time getting around, our community health workers go into the home and help them, look at their medicine, make sure they take their sugar test and their blood pressures, and help them get their medicine, maybe take them to the doctor if they need to. We have several diabetes education classes. We do diabetes self-management classes, nutrition classes in the community. We have the state funding for the food stamp program for education for that. So we go into any schools that are over 45% free lunch. And we go in and do educational things with the kids. And we've offered, like this last semester of school, we offered a $500 phys ed equipment stipend, I guess you call it. So we bought them $500 worth of phys ed equipment if they did this nutritional class, and they agreed to put healthy foods in their concession stands and those kinds of things. So what Deb and I were talking is there are some things that we would be able to offer as a larger group that your county doesn't have right now. We don't know what the drawbacks are of that yet because we're trying to figure, because of course the Mid-Ohio Valley Board of Health, we've talked to the Board of Health here because the way it works there is that the county commissions appoint the 2 people who sit on the Board of Health, and the Board of Health is 14 people now, because we're also the health department for the city of Parkersburg. So there are 2 people represented from the city of Parkersburg and 2 from each of the 6 counties. They're appointed by the county commissions, and they are 2 varying political parties, whatever those 2 are, but they have to be 2 different political parties. And then they sit on the Board of Health. Now you have, for example, a 5-member Board of Health right now. So just the reality, 3 of those people would not, now they could be on advisory committees or, so these are, it's not all going to be easy. There are some things, hard decisions that we would have to make in order for that to happen. Some of the things we do, and I'm not sure you all do them here, but like Tanya's group at the clinical, they go out and do flu shots in about 60 different businesses. We take it out on the road to the businesses so they don't have to come in. And we also get a big discount on the flu vaccine, which is hard for smaller counties to do, and so then you're at the end of the year as a smaller county, you're left with, $5,000 or $10,000 worth of flu vaccine that you can't use, whereas because we're the largest purchaser they allow us a credit on the next year. So that's something that we offered this year to smaller surrounding counties. But we just don't know what all the decisions are that'll have to be made. We've not done this before, and as far as adding another county, it's been these 6 counties since 1982. But I do think it's worth exploring for, for what's coming down the road, just in case you find yourself in a situation where, you want to have to regionalize, because the big thing is population. We're pretty sure that the performance standards are going to include because the studies show that you get a better result serving over 100,000 population. Well, you know, Wood County wouldn't even be able to do that, you know. So our total population in 6 counties is only 131,000. So I don't know, I just think there are things that we can explore. So what I'm here asking you all for is to approve for Deb and I and the board to just explore the possibilities and come up with a plan that could work for both of us, and then present that to you all, because you all would have to approve it anyway before it happens. Does anybody have any questions?
I have questions. I think you answered a couple of them at the meeting. You mentioned the sanitarium. Okay. You mentioned that you're going to add sanitarium. You're going to add another one in Douglas County?
Well, I don't know yet, but I'm saying that's a possibility within, you know, in the plan, because we share sanitarians around all of the counties. So you would be in the mix of all the places that we share the sanitarium.
So our sanitarian would have to go to another county possibly to work? Not all the time?
Well, he might, but I would doubt it, because usually we have one who sits in the county, you know, like Randy Lowe's over in Rome County, you know, usually Liz might be able to answer this better, but I mean, I can't imagine that theirs, because you're already shared with Wetzel Tyler, right?
Ritchie County has a full-time sanitarian, and Roane County has a full-time sanitarian. The other counties have like 3-day-a-week sanitarians and 2 days in Wood County with their full-time employees.
Okay. And we're not going to lose any employees at our health department?
That is the goal. I have no thought that would happen. And Deb and I have talked, because, you know, there would be one administrator, so her position would be the one that would be, because everybody else has a job and that's needed. But, you know, Deb is a nurse, and I highly respect her abilities. And so we've talked about things. I mean, one possibility might be that she could be the operations director for the whole, you know, all of the counties. So respecting her and putting her in a position that, you know, matches her skill levels and her experience. And but she understands that she would not be a you know, healthcare administrator anymore, because there's one administrator in the regional system.
So can you guarantee us that we're not going to lose any employees?
Well, I don't know about guarantee, because I can't guarantee I won't lose employees from time to time. You know, employees come and go, but I can tell you that the goal is, I really am a do no harm kind of person. I really think that, and I can't imagine how we could run the health department without the employees that you have now anyway. Home health is an issue. We don't have home health, but my thought is you wouldn't want to get rid of that, because it works, it's good for your community. You know, having Deb there who knows how it runs would be most helpful, because I haven't run home health. So, I mean, you know, we're going to have to look seriously at, but I don't think you should get rid of it. It's a viable operation. It serves a good need in your community. It's just different than what we do. But, you know, each county is different. Just like, for example, Calhoun County, we're right there on Minnie Hamilton's, you know, back door. So we don't do as much, because we collaborate with them a lot. If they're offering it, there's no point for us to, you know, we just make sure we do the basic public health services. And then we work with them and partner with them on grants and things like that. So.
Thank you.
What sort of funding would be required of Doddridge County? And I know that you probably can't give a specific answer for that, but any?
Well, there would have to be, the way I see it working, I didn't mean to interrupt you.
No, go right ahead.
Okay, the way I would see it is there would be some indirect charge, you know, like an overhead cost for whatever. For example, if we're taking over administration pieces of it, you know, and we're doing all the program plan reports that the state requires, and we're doing all the back office administration pieces, then we'll just have to figure out what's a good cost for that and propose that. Because that's what I was going to say earlier, so I'm glad you brought it up. I don't want it to sound like we're being all benevolent and we'll just, you know, let you. It's going to be a win-win for both of us, or there's no point in doing it. So, I mean, there would be, you know, we would gain a population, we would gain more political clout, because right now we have more political clout than any, health department in the state, because we have so many delegates and senators in each county and mayors and that. So it would add to that, which would be a benefit to you and to us, But I don't know exactly what the cost would be, but it would be definitely part of the plan, because that would be how I would see doing it, is doing it as an indirect charge. So that because even the programs, like the state programs, like the WIC program, which I know you are in another region with Mon County, but actually the Mid-Ohio Valley Regional WIC office, we serve over 5,000 mothers and babies. And it is actually in our building. But that program pays an overhead indirect cost to the agency, because they're a state program that's sitting within our building and our structure. So I would see it being kind of like that, that there would be an indirect charge. I don't see the day-to-day operations changing a lot, other than because environmental health is going to be working on these national standards, and the expectation would be that your county would be a part of the national standards, and whatever that means when we get into environmental health. So that's why I wanted Tanya and Liz to come tonight, so they could hear it from the beginning of how we're talking about doing this, so they can be a part of the process for how it would work. But I don't know, it really is up in the air right now. All we've gotten to is we think it might be a good idea.
Well, I guess the point or the question, obviously, if, as indicated, we have to take a 25% cut from the state, that's going to have to come from somewhere. And if that continues to be cut, that's, the only logical choice would be that comes from Doddridge County Commission. And then I guess my other question, and I hate to put Randy on the spot, but we have a levy that funds, that partially funds the health department. If we were to regionalize, would those funds be available to?
It depends on how the levy was written.
It's probably something we need to.
Well, my thought is it stays in the county. We have a levy in Pleasant County, and it stays in the county. What we do is we have bank accounts in each of the counties, because our, West Banco is our main one there in Wood County, and they don't have that in every county. And so we keep the money for that county and that the county commission provides in that county, and then spend it out. So it's kept separate accounting is kept of each of the counties. Now, as Dr. Wharton will say from Ritchie County, the Ritchie County Commission gives us normally $6,000. They gave us an extra $4,000 because we're putting in a handicap parking space, another one. But usually they give us $6,000, and what they get out of that $6,000 they could never get for $6,000. But with Doddridge, it's going to be different, because you're a well-run county, and you're in the black. You've got a good home health, So disturbing that as little as possible, to me, seems like it would be the best thing to do. But yeah, with the levy, we have one. It's small. It's not as big as yours, but we do keep it in the county. And then I go around to the county commissions and I let them know we keep fact sheets on each county, so we keep even the data is separate, so we know what all we've done in each county, and then we go to them and present that information when I'm, begging them for money for the next year. But yeah, and something you said too, like with Mid-Ohio Valley, this loss of 25, because that 25% in Mid-Ohio Valley means $313,000 we're losing. But if you look at our payer mix, we are only, now we're getting really close to, we're about 26% of our total budget is state aid dollars, which the average across the state is 40%. That's because of the enhanced services that we have and that we're able to bring in some money. The changes that are happening that would impact you as we do this, because I'm looking to the same thing you are. How can I sustain my health department in these ever-changing times of dwindling dollars? to do that, it's going to require primary care services. So we are working right now with the Good Samaritan Clinic in Wood County to merge with them and begin offering some primary care services out of the health department. It won't compete with the FQHCs because the Good Samaritan Clinic has their set of patients, that they see. And we're already credentialed to all the insurances. We're going to have to do some work in that, well, not all of them, but I mean the main ones that we take. But that's just, again, in the beginning stages. But it's the way I'm looking. If it's not the Good Sam Clinic, it's going to be something because we've got to start providing reimbursable services. That's the only way health departments are going to survive. So the thought would be if we do primary care and we get it started in Wood County, then we take the show on the road and we go to the outer counties. And maybe once a week we hold primary care clinics. So that would help all the counties that are part of it. So we are thinking in the same way. We've got to do something to shore them up.
Butch?
I'm good, thank you.
So what you're wanting is a recommendation from the county commission that you continue to explore this? Is that what we're looking for? Myself, I'm not into micromanaging. There's a reason why we have a Board of Health, and they are to look out for the best for the citizens of Douglas County, and I believe they do that. And if they explore this and recommend that we adopt it, then we'll consider that. But I will make a motion that we recommend that you explore this and then get back with us once you come up with some conclusions. We've got a motion. All in favor, signify by saying aye. Aye. Opposed, same sign. Motion carries.
Thank you.
I don't see Jeff Harvey here.
See nobody here. I don't know what happened.
I thought maybe he was going out to check. Maybe he was. Maybe I'm sitting here waiting.
I don't know.
He just got up and walked out, so I kind of assumed that he was going to see if there was.
That's why I thought he was going to check you.
Well, I don't see him or anybody from the FRN here, so we can table that, and if he happens to come in, we'll deal with it then. Do we have a motion to table that?
So moved.
All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Okay, now we have on the agenda is the resignation and appointment of coroner.
I spoke with Phyllis. She does intend to resign. I haven't received her. I've told her that we would need the written resignation. I have not received it yet.
But did she indicate she would?
She did indicate that she is
Okay.
resigning due to health problems, and she would send us the written resignation. I just haven't received it yet.
Okay. Well, then I guess we need a motion to table to a future meeting.
Move the table.
All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. Okay, the ES&S quote, electronic poll books for early voting. We tabled that the last time because we didn't have an exact quote. We just had a approximate figure. Beth gave me, and the total is $2,594. If you want to look at it. It was the demonstration that the young man gave last meeting for the, kind of like a tablet, isn't it?
Yeah. They
Or an iPad
They
type?
would sign that, like going to Walmart to sign that, and then the poll workers can take the signatures that's on the electronic pad.
2,594? Okay.
2005-94.
Hey Beth, what kind of warranties on that thing? I mean, service charge, you mean something happened to them, did they
Well,
come?
we have, they'll probably have a maintenance agreement,
Okay,
because we have one like with the machines and things like that. Like ES&S always comes before we have a primary election, and they check all the batteries and check our machines out, and we have a maintenance agreement with that. So I'm figuring that's probably going to come with that.
Look, see. Said 1 year warranty.
And we're going on it, and then they do regular maintenance on stuff.
Give it back to Beth. All right, do we have a motion?
I move we accept the proposal.
We have a motion to accept the quote of $2,594 for the electronic poll books for early voting. All in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries.
Thank you.
Welcome.
Next item on the agenda, Granville and Rose Chris. Consolidation of land.
Yes. Yes, we have 2 deeds to the land, and one's just as far as 29 acres, there was at 43.86. We will, maybe we'll get it consolidated into one deed where we have one tax bill instead of 2.
Just your paper.
Are these contiguous, side to side?
Yeah, yeah.
They have pretty good.
He got a map bill.
Okay.
That little piece there was 23, and then the big lot is 43. Now that little side, that was just 8 and 10 saws.
43 and,
And
8 and
10,
10.
this little one right here. 8 and 10.
yeah, that's 2,900, 7 acre.
Uh-huh.
Okay.
Okay, and you have talked with the assessors, or the assessor's office?
Yes.
Yes.
Okay. And they're okay with it?
Actually for it.
Pardon?
Yeah.
Actually for it.
I'm sure, because what's one
Right.
less tax bill and one less parcel that they have to assess.
Okay, do we need to make a motion on it, and then you'll have to sign this?
Have to sign that, okay.
Yeah.
All right.
Well, I move we grant their application for consolidation of their 2 parcels.
Yeah. Let's see, maybe he signs it. Yeah, they'll sign it. Yeah, they'll sign it. They have to sign him.
They will?
They do, yeah.
Okay. Made a motion.
Okay. All in favor signify by saying aye.
Aye.
Aye. Opposed, same sign. Motion carries.
Beth said they gotta sign it right here. Here.
You each have, you both have to sign, since they're the man for now. And then I'll make a copy of this for them, and then I'll write a letter to the assessor telling them that you've approved it. blame their own father. They don't have that clear what to do with. Thank you.
You moving now?
Sure.
Put it back.
This is the first time I've ever been in this room, it's chilly. Oh, it's hot. What happened?
Then you may have a
That's
special.
why I wore long sleeves today.
Cold out there.
Did you swear?
No, thanks, come on.
Jack over here.
I know. Usually so hot in here, you can't breathe. What happened? Boiler out? Boiler not working?
Okay,
Thank you.
thank you. Are there any exonerations?
No.
Any probate orders?
No. And that.
It's not on the agenda, but do you have a
The
report?
grandmas took it off.
The Gremlins took it off? Do you have a report or not?
Didn't bring one with me because I'm not on the agenda.
That's fine, because you weren't on the agenda.
I
huh?
was yanked off, so I just take my coins and go
It was
home.
the Irish, George.
You're following the rules.
Yeah, it's just.
I'll have one.
Came in and took
I'll have
it.
one.
Okay.
Get some pest control in here.
That concludes our regular meeting. We're going to be signing invoices. Well, there is a budget revision if anybody wants to stay for that.
Last month I had moved the money for the, what you voted on for the park. And I moved it to 900, I should have moved it to 998 for your capital project.
Okay.
So we're just moving it from the 900 to the 998.
Okay.
And just fixing that. You approved computers for the law enforcement a while back, but we hadn't moved the money yet. It's $7,890. That's the only two things.
I had a giant iced coffee and it was delicious.
Are these just enter?
No,
No.
they're state revisions, because
Okay.
they're going from one account to the other.
Okay, it's just basically housekeeping though?
Yeah, in one,
Yeah.
I just to fix a mistake I made last time, and then the other one's to give the money to law enforcement that you promised them.
For the computers, yes. You have any questions?
No.
All in favor, well, we need a motion, don't we? Okay, we have a motion to approve the budget revision. It's housekeeping and it's transferring the $202,302 from one account to another. And the same for the $7,890 for the computers for the law enforcement. All in favor signify by saying aye.
Aye.
Opposed, same sign. Motion carries. We're waiting on your signature. Okay. Seems to be a musical group for you.
Yeah.
Okay. Now, that concludes our regular business. We're going to be signing invoices, so if you want to stay for that, you're more than welcome. But we're